Welcome to AETCM, the emergency medicine channel. From today onwards, we are going to start one new system, that is our genito-urinary and then renal emergencies. So as usual, whenever we are starting the new system, always we have a habitual we'll start with the assessment part. But in this system, we are skipping that part because majority of the things what we discussed in a previous presentation and then last system, like our gastrointestinal system only, that is following same assessment format only. Some other one or two extra things are there that we will discuss along with this emergency while doing another presentation. We will alongside we will discuss. So in this first part, we are focusing on the urinary tract infection. So this is what our content, introduction, and then what are the common organisms, clinical features, and then how we are classifying the urinary tract infection. What is our assessment point mainly in the pre-hospital, management, how we have to tackle over the pre-hospital, both in hospital, finally what are the complications. So first thing, urinary tract infection. So it is a straightforward answer, no need of any confusion. So simply you can define it is a infection in the urinary tract. So urinary tract in the sense that is starting from our kidney to until the urethra. So if any infection that is happening in the urinary tract means that is called the urinary tract infection. So when the person will approach us or when the person will approach in-hospital ED or pre-hospital emergency medical service means, if the person have a persistent fever along with if the complaints of any dysuria or increased frequency of urine, or if they are feeling any urinary retention means, on the time they will raise help or they will ask help to the emergency medical service. So this is what the scenario behind the urinary tract infection clinically we are defining. But how the microbiologically how they are defining means, so here if you want to define a microbiologically means, it's defined as a multiplication of organism in urinary tract, and the range will be greater than 10 the power of 5 organism per ml or in 1 ml of midstream urine sample. Okay, so the terms are organism. So organism indicates both your bacteria, virus, and then fungus. If the level will be more than 10 the power 5 organism in a 1 ml. So the thing is, where we are looking means in the midstream of sample of urine. So this is one of the important thing. Midstream sample of urine is a one factor we have to remember. Okay, so why we are mentioning that midstream urine we are stressing means, majority of our people we are practicing in the in-hospital scenarios. So when you are handling an in-hospital scenario, if you are encountering the person or if the physician, we are getting order like a urine routine, or if you want to perform any urine culture means, you have to advise the person to take the midstream of urine. Means first while voiding, you have to ask the person to void some amount and then the person have to collect the midstream. Why means, so while voiding, if the person is collecting the first part of urine means, that will be contaminated with your urethra, right? So to avoid that normal flora or contamination, urethral contamination, we are recommending, or there we have a recommendation of midstream urine sample collection. That is the one reason for the midstream urine. So this is most common, that urinary tract infection is a most common in the female cases compared with the male cases. What is the reason why it is most common in the female? The reason is that is the anatomical structure is a one reason. Means, so there is distance between your urethra to your anal canal is very less compared with the male. There is a distance between the urethra and then your anal canal opening is a very short distance. That is the reason, one reason for the female is more common, incidence wise female is more common for the urinary tract infection. That is about less than 4 centimeters something it have things. The why the anal canal, we know that is a highly contaminated area, so the easily it will reach out your urinary tract, it will cause the urinary tract infection. So then what you will tell about the male cases? In male cases, it is will occur in the case of any anatomical abnormalities, like if the person have any trauma related things or anatomical abnormalities, any stitches or because of any urolithiasis, any stone formation. These are the some structural deformity can lead into the urinary tract infection. So the one more important thing, that is the vesiculo-urethral reflex. So what is meant by vesiculo? Vesiculo or vesicle means that is representing cavity. Okay, it's a common terminology. Wherever in our body cavity is there, we will call as a vesicles. Okay, so in urinary tract where we have a cavity, urinary bladder is one of the one, that's the one cavity, right? So cavity here, vesicle representing cavity. So in your urinary tract, cavity is a urinary bladder. The one other part is a urethral. So ureter, we know that is the connection by between your kidney and then bladder. So that is the ureter structure, right? So if you are combining everything, means there is a reflex of urine from the bladder to your ureter. That is called the vesiculo-ureter reflex. Okay, there is a reflex of urine from the urinary bladder to your ureter, that is called the vesiculo-ureter reflex. Sometime the urine may reach out the, so until the ureter or half of the ureter. Sometime it can reach out the kidney also, that pelvis of kidney also it can reach out. So this is condition called the vesiculo-ureter reflex. This is one of the common cause for your urinary tract infection. So this is the normal thing. So here we can see that urine getting backflow into the your ureter. This is called the vesiculo-ureter reflex. So how we are classifying the urinary tract infection? So we have a kidney in our kidney, and then we have a ureter. Here we have a urinary bladder, trigonal. In lower trigonal we have a urethra. If it is in the male cases, means we have a here prostate also we have. So the upper urinary tract up to the ureter we are calling as upper urinary tract. So for each tract we are giving two structures. For upper urinary tract we are giving the your kidney and then ureter. For lower urinary tract we are giving the bladder and then ureter. If we are in the case of male, means we are adding prostate also, one of the structure in the lower urinary tract. So if any problem arising in the kidney like pyelonephritis or any like intrarenal abscess or perinephric abscess, peri means around, so it is around that structure, right? So any abscess that is forming around the renal, means these are the things will comes under the upper urinary tract infection. Then you are coming in the lower urinary tract. If any bladder getting inflamed or infected, means that is called the cystitis. And then urethritis, if any problem in the urethra, means urethritis. Or if any problem in the prostate, means that is called the prostatitis. Okay, prostatitis. Then common organism, most common organism, it is your gram negative Escherichia coli. That is the 75% of the cases. Escherichia coli is E. coli is one of the common organism, and then other like Protease, Klebsiella, Enterobacter, Pseudomonas, Streptococcus, Staphylococcus, Chlamydia, Neisseria gonorrhea, Herpes simplex. So all these things are common organism. Why we want to know this organism means, so based on that organism our choice of antibiotic, or whether we will choose antibiotic or some other drugs, like if it is a fungal, means antifungal drugs. So this is for to give a definitive treatment for the person. So based on that antibiotic, so based on that organism we will change our antibiotic strategy. For that reason we are ruling out the, we will go with an urine culture and then sensitivity test. Based on that sensitivity culture test we will treat the person. So clinical features wise, the three important features: first one, dysuria, difficulty in urination, and then increased frequency and then urgency. So these are the three major triad features that will arise in your urinary tract infection. Along with, the person will have a fever, chills, rigor. Those are the some common things. So pain wise, where it will arise pain? So it is, pain is completely depend upon the area of infections or area involved in the infection. So if the pain or if the infection happening in the bladder, means so there is a lower abdominal pain will arise. If it is targeting in your ureter or kidney, means the low back pain, flank pain will be arise. So where you will define the flank region, where it is, means flank region is nothing but your space or that area between your 12th rib and then your hip bone, ilium of the hip bone. That is the space between, this is the space of flank region. Laterally, how we are defining means, so this is the imaginary line of anterior axillary line, this is the imaginary line of posterior axillary line. So this is where the area we have a flank. So it is the area between your 12th rib and then ilium of your hip bone. Anterior, this is superior and then inferior. Laterally, how we are defining means, it is a space between the anterior and then posterior axillary line. So this is the region, flank region, the person will have a pain. So why we are forcing this one means, while the time of assessment we have to note it down, these are the things. And then costovertebral angle tenderness. Sometimes the person will have a complaint over this costovertebral angle. Where is the costovertebral angle means? So that is also again the term itself giving. Costo means that is representing our ribs. So it is the angle between your 12th rib and then your corresponding vertebra. Okay. So it is an angle between your 12th rib and then corresponding vertebra. Majority time it will be your 12th thoracic 12th vertebra, correct? So it is an angle between your 12th rib and then corresponding vertebra. This is called the costovertebral angle. And then pelvic or perineal pain in the men, which can suggest the accompanying of prostatitis. So assessment point, getting into an assessment, so we'll follow our assessment. So how we are defining, how we have assessment format, we'll do in the all other emergencies. So we'll start up with the scene size up and then scene safety, right? So this is one of the important thing. Whenever that personal protective equipment, everything you should be have. So second thing, so because sometimes you can expose to the urine also. So that is why highly recommended PPEs. So second step where we'll go, we'll assess the mental status, right? So mental status wise, if the person have any perinephric abscess or if the person have any pyelonephritis cases, that person may get into the urosepsis or the person may land up into the septic shock also. In this time, there will be an alteration in the mentation or can also occur, means there will be an altered level of consciousness, there is a chances are there. Okay, this is the reason you have to thoroughly assess the mental status. Let's say the condition like pyelonephritis or perinephric abscess, it can land up into the urosepsis and then septic shock. In this case, it will alter the mental status. So this is one of the thing. Third one, your ABCD, airway, breathing, circulation, disability, exposure. This is the common thing. Exposure wise, you have to check that fever means, so adequately we have to treat with some antipyretic also. Fourth one, we are moving on to the sample history. So sample history wise, yes, for signs and symptoms. So signs and symptoms, the same thing only. So whatever the dysuria and then frequency, urgency, it's a common things. Along with the person may complain about the fever, chills, rigor, pain. So these are the common factors we will encounter in the case of UTI. So whenever you are having these many symptoms, so you have to appropriately mention dysuria, frequency, urgency means, fever means how much degree it is, and then whether it is an intermittent fever or persisting fever, relapsing fever, that is and all you have to make it out. So A means allergic history, that we know, and then M means that is a medication history. So medication wise, so sometime because of the fever and then because of the pain, the person will take some medications like antipyretics. So that we have to ask. So if the person took already antipyretic means, so we have to ask which drugs they took and the dose of the drug and then when they took. So these are the time and all we have to ask. And then P wise, that is past medical and surgical history. So this is also sometime the person have a recurrent urinary tract infection. So that we have to collect, if the person have a recurrent urinary tract infection means, then we have to ask when was the last episode, whether they took any treatment or not, still they are continuing or not, that and all we have to ask. So surgical history also, sometime in a male cases stitches we told. So some of the people for stitches, they will regularly they will do some dilational, urethral dilational procedure also. they may gone for in a previous history. So that also we have to ask. Last oral intake events lead to injury, that is also we have to keep in mind. And then one more important thing for the pain assessment, so we have that OPQRST mnemonic, right? So this is also we have to rule out. O means onset of the pain. So when the pain will arise, mainly the pain usually it will persist. So from if the urinary tract arises means the pain will persist for until that resolving, it will persist. But when it will provoke, when the pain will, the intensity of the pain will increase means, if the person try to voiding the urine or if the person try to urinate means, on the time the pain, the intensity of the pain will increase. So that is called the O and then P. Q means quality of the pain, how the pain, the nature of the pain, how it will be means, the nature of the pain wise, it will be like a burning sensation. So you can ask the person, how was the nature of the pain? So the person will tell the burning sensation, that's one thing. And then R wise, region and then radius. Region, as like we told, it is depend upon the location or it will depend upon the structure involved. If the person have a your kidney means that the person might have a pain in the flank region or costovertebral angle. So if it is bladder or urethra means, so depend upon the area, that site or region of the pain will differ. Sometimes if it is the urinary tract, because of that urolithiasis stone means, it can, the pain can radiate into your groin region also. So SY severity, so again it is also the severity of the pain will depend upon the condition or duration of the UTI, T for the time. So this is the format, sample history and then OPQRST. So this is what we are describing in this 2 slides. Okay. And then management, final part, scenes is assess the mental status, identify and treat the life-threatening conditions. We have to allow the patient to write the positioning of the comfort, be prepared for the nausea and vomiting. Sometimes because of that increased pain, it can stimulate your nervous system and then it can lead to the vomiting also. It is pain-induced vomiting. So we should be ready to treat that condition. And then person with the pyelonephritis, so we told, right, pyelonephritis and then perinephric abscess that can lead into the urosepsis and then septic shock. So if this the person have a low BP, high heart rate means, that we have to adequate volume resuscitation should be done in those cases. Transport the person to the nearest appropriate facility for the evaluation. So the thing what we are focusing in the pre-hospital means, first you have to remember that we have to manage that fever, that is one thing, with a appropriate analgesic and then antipyretic medication. So because pain also one of the factor. Second thing, we have to remember the pain induced nausea is there means, that we have to manage. Majority of the UTI cases need a continuous antibiotic therapy, then only it will resolve. So to take an antibiotic therapy, we have to shift the person into the nearest transport, nearest definitive care. That is what we are focusing on the pre-hospital. Sometime it is majority of the time the necessity of the urinary catheter also is there, but it is better to take that urinary catheterization procedure. I think in hospital is more good to perform, because if we are trying in a pre-hospital region, if sometime it can rupture the urethra, then it can land up into the some other complications. So if it is permitted or if it is permitted, your concerned physician said okay means, we can do the Foley's catheterization in the pre-hospital region, but it is not applicable means, it is better to do in the definitive care. So this is the antibiotic choices in the cases of urinary tract infection. So we can just go through. And then a main important thing in then antibiotic wise, one thing you have to remember, fluoroquinolone should be avoided in the case of pregnant ladies. So why means, fluoroquinolones, that's the drugs we know, norfloxacin, ofloxacin, that should be avoided in pregnant women, because it will cause some developmental issue in that growing fetus. That is why fluoroquinolone should be avoided. If it is a complicated UTI means, antibiotic regimen should be continued for the 14 to 21 days, that is recommended. Supportive therapy, we have to increase the fluid, we have to ask the person to take increased amount of fluid, or if the person in altered mentation means we have to administer the more amount of fluid based on the cardiac and then renal function. Alkalization of urine, that is we have a one syrup, right, that syrup citralca, or the other name we can say disodium hydrogen citrate, so potassium citrate, those also we can use. So analgesic and then antispasmodic also recommended one. So do your best. Shalom.